Hey, good morning, everyone. We're just going to give it a couple more minutes to see if others are joining us, and then we'll get started. Okay, let's go ahead and get started, and others can join us as they jump on. But we have a packed agenda, so I'll make sure we can use every minute. So good morning, everyone, and thanks for being here early on a Tuesday morning. um, Instead of doing like a formal roll call, if we could just have folks like we did last time, just kind of put in the chat your name and where you're from, because we do have some guests joining us again today, so that everybody can get a feel for who's in the room. Um, and so today on the agenda, I have just a few updates for you all, and then we're going to have two presentations from Scott Prescherfeld and Michelle Beck. We're going to talk about some of the injury and criminal justice data available at the state level. And then we will spend the rest of the time talking through the strategic plan and gathering feedback from you all. And then we'll give an opportunity for you all to share any updates and then wrap things up. So, jumping right into the updates from OVP, a lot has happened since the last time we met, but in a good way. Um, First of all, related to staffing, as you know, last time we were talking about how we were going to be releasing postings for positions for two program coordinator positions for our office that were funded through our CVIPI grant that we're going to be helping to support our training and technical assistance work related to community violence prevention. And so since then, that posting was released and it closed a couple of weeks ago. And we got a lot of great interest in that position. We got many, many applications. And so right now on our end, we are going through applications and planning to um, move forward with interviews over the next couple of weeks and are hoping to identify two candidates by hopefully the end of the month, but if not, hopefully in early September. So as there are more updates to share about that, we will keep you posted. And hopefully by the next time that we all convene, our program coordinators will be on board and you'll get to meet them. And then one more staffing update that I have for you all. Last time I also shared about the firearm epidemiologist position that we were getting ready to hire that was going to be a partnership between DPS, between OVP, GCC, and the Injury and Violence Prevention Branch. And I am happy to say that that person has started. So her name is Kenla Hanel, and she will be joining us today. So when she does, I'll have her wave and show her face so you all can meet her. But she is a recent MPH grad from UNC, and she started maybe 2 weeks ago. So she's still brand new and still kind of getting her footing. So the way that this shared position is going to work, which is something we haven't done before. So we're kind of working through the kinks as we go. is that she's going to spend her first few months over in the Injury and Violence Prevention branch with Scott, getting trained up on their data systems. And then she'll go over to the GCC with Michelle and get trained up on the CJAC data, and work with her on a project. And then after she's all trained and has access to all the different data systems in their shops and knows how to utilize them, she's going to come over to OVP, and then we'll work on some projects related to data translation. And she just came on the screen. So hey, Kenla. I don't know if you want to add anything to your introduction.
Yeah, no, you're good. I'm sorry. I'm still getting used to this WebEx application, and it kicked me off a couple of times. So, hello, everyone. My name's Kemla. Ciara did a great introduction for me, so I'm happy to be here to work with in Firearm and get to know everyone. So thank you, Ciara.
Yeah, thank you. We're really happy to have you. So you'll be seeing a lot more of Kenla as we convene and as we meet. And yeah, we're just really looking forward to having her. So those are all of our staffing updates at the moment. Are there any questions about any of that?
Nope. We're good.
Hearing none, I'll keep going. So next updates that I have to share with you all are related to the statewide convening that we're planning. So I believe I may have mentioned to you all this in our last meeting that this is something we were looking to do. And since then, we have moved forward on the planning. So we've put together a planning committee based on the survey that we sent out and the folks who indicated that they were interested in potentially helping to be in a new subcommittee a bit more involved in planning. So there's a good group of maybe 10 or so of our advisory board members who have been meeting with me weekly, which I really appreciate, to move forward on thinking through plans for this event. And so you all should have received a save the date yesterday. So this convening event is going to be held on November 19th and 20th here in Raleigh. And the purpose of this event is to basically provide a learning and connection opportunity for folks working in community violence prevention across the state. So we're hoping to bring folks together to meet other people in different corners of our state doing comparable work, and then to learn from each other and learn from subject matter experts to bring back some new specific tips and tricks back to their programs. And so the planning committee and I are working through building out an agenda. So we've kind of been thinking through as a group, but also collecting feedback from other folks. And so we're hoping to have a lot more details about that agenda and details about the event ready by September to open up registration. So you'll hear more updates around September about the event and specific details about registration. But really looking forward to this and hope you all will be able to join us. And you should have received an invite for our next advisory board meeting. And so we're going to coincide that advisory board meeting with this event. So it's going to be on the morning of that first date of this event on November 19th, also here in Raleigh. So hopefully that makes it easier for folks with traveling. You only have to travel one time for our advisory board meeting and this event all at once. All right. I feel like that was a mouthful. Are there any questions? Okay. Well, hearing none, we will move forward to our presentations. Oh, actually, one more update is just a reminder. We sent out an email to you all sharing about GCC's RFP for their burn skip funding, which community violence prevention programs fall under one of the funding categories. And so you should have that in your inbox, and that funding announcement closes on August 23rd. And Caroline Farmer, if there's anything more you want to add to that, please feel free.
I would just say, if folks have any questions about the application or the process, please don't hesitate to reach out to us, because it's a new system, so there are some glitches. So, but please don't hesitate to ask. Thanks so much.
Thank you. Okay. And so with that, those are all of our updates here from OVP because we'll talk about the strategic plan later. So now I'm gonna move us into our presentations for today. So like I mentioned, we'll be having presentations from both Scott Prushield and Michelle Beck talking about the data that they have available both in the Injury and Violence Prevention branch and then the Criminal Justice Analysis Center. And I invited them here to present today because we get a lot of questions here at OVP about data available for different local programs. And I think that there is an assumption that our office is collecting, storing, providing data, but we are not. All the data that we get comes from mostly their two shops, as well as some federal sources. But yeah, they are our resource for data, state level data in the state. And so I wanted them to come here today and just share so that you all can just be aware of what injury and criminal justice data is available, not only to our office, but to you all and your programs and also the programs that you support. And you can point people in the direction of these resources when these come up. So we're going to start with our presentation from Scott, and I see he's already ready. So I will pass it over to you, Scott.
Yeah, thanks, Ciara. I appreciate it. And it's nice to see lots of folks again. And, there are parts of this presentation that probably some of you have seen, but maybe not all of you. And I tried to kind of lay out a couple of different things. Mostly some of these things might be for future reference. So again, there's a lot of slides, but I thought that that would be useful for future. What my hope was today was to just kind of go through injury and violence surveillance just in general and talk about the systems and kind of the pros and cons of each of these systems, just kind of more general awareness, talk about some of our enhanced surveillance around VDRS, the Violent Death Reporting System, and NC Faster, which is an emergency department system, share some examples, and then open up for questions. And speaking of questions, so I can't see the chat or anything. So if people put questions out there, Ciara, just let me know.
Yeah, I'll help you out, Scott.
I think, if there's a clarity question, happy to stop kind of midstream, but I think in general, it might work best to just wait till we get, to the end. So kicking things off, public health kind of works in this framework where we have essential services. And so a lot of these services that involve my shop are really monitoring and assessing the population health and kind of diagnosing and investigating some of these issues. And so, we want to be data driven. And so, of course, we want to make sure that we're focusing on some of these things. So our branch, the Injury and Violence Prevention branch, sits within the Division of Public Health. And kind of our mission is to collect and analyze some of the injury data to better understand the problem, implement programs and to prevent injuries, and coordinate and work with other groups to address the problem comprehensively. My shop and specifically is the Injury Epidemiology, Surveillance, and Informatics unit. And our core functions are, again, to monitor that landscape, to assure and improve the data quality, to expand some of the surveillance that we do, disseminate the data, which is a big piece of what we're trying to do with some of our violence and injury work, and of course, share for prevention and act for equity. So Steve Thacker was a longtime CDC, surveillance guru, but I think his definition of surveillance is important. And of course, because we're partnering with public safety, sometimes the word surveillance means very different things. And so in our sense in public health surveillance is the ongoing systematic collection and analysis and interpretation of outcome-specific data for planning, implementation, and evaluation of public health practice. Why is it what's important in surveillance? Data collected in a timely manner, disseminated in a timely manner, the looking of trends over time, and trying to detect emerging threats or some types of special events. So again, for some of our overdose work, we've seen emerging drugs kind of come into the play, and with some of our injury and violence, we've seen things like massive shootings and things of that nature. This is a really busy slide, but I'm going to walk you through it. In the upper left is the population of people, and people are either exposed to a virus or exposed to kind of an injury, and an event happens. And because of that event, you either have symptoms, you seek care, you're diagnosed, sometimes you have treatment. and you recover, and you might recover with a disability or you might fully recover, or you might have a death related to that. Now, in our state and in most states, every single one of those times that someone interacts with one of our systems, usually a specific system that collects that data. So below that line, I've kind of highlighted each of the data systems that, in the event, say, a firearm event, law enforcement are called, EMS are called, that person might be transported to an emergency department, that person might become part of the trauma registry. They might become part of other kind of things. If they die, there's a death certificate process, medical examiner, all of these things. Now, each of these systems kind of has its own data governance and its own data structure, which is what makes some of the work that we do challenging. What I wanted to talk today really about was the Division of Public Health, kind of the big three: death certificate data, hospital discharge data, and emergency visit data. And again, for each one of these, I'm just going to try to provide kind of a brief overview. Death certificates in our state are public record. It's the official state record of the cause of death. Data have been collected for a long time, since the 1900s, early, and electronically from the 1960s. Although we just were, unfortunately, one of the last states to have electronic death certificate process. So that process literally just started within the last couple of years, something called NC-DAVE. But we have an average or around 110,000 deaths annually. Again, the pros of this system are it's public record, and you can call down to the North Carolina Vital Statistics record today and request kind of death certificates for a certain number of years around a certain topic, and those will be sent to you in Excel, SAS, all kinds of different formats. Some of the cons of that system, there tends to be some misclassification, particularly around American Indians. It's limited in terms of demographics. There's only about 30 different demographic features, all important, but only about 30 demographics. So sex, age, race, ethnicity, a handful of other things around occupation, industry. And it doesn't clarify whether that case was involved with another case. So if you have a murder-suicide or if you have a mass shooting, it doesn't say on the death certificate that was part of that. It doesn't talk about circumstances. So death certificates, super important, kind of some of the core work of public health in general for all kinds of topics. We use them very extensively. Our team uses them pretty much every day to help us understand some of these events that are happening around injury and violence. Hospital discharge data. So this is the hospitalizations that happen in our state. This is both admitted to a hospital and emergency department visit, although we have kind of a separate system for ED, which I'll talk about here in a second. The hospital discharge data is provided to the state health director and officer by statute and housed in the State Center for Health Statistics, and really is used only for public health surveillance purposes. It has lots of different coded fields. So for those familiar with the healthcare industry, it has about up to 100 ICD-10 CM codes, which are the diagnosis codes that are utilized for that system. And we've been receiving it, our branch, since about 2017. It is really the data of the North Carolina Healthcare Association. They're the data steward of that. We have about 131 civilian coding hospitals in the state who are working on that data. Again, some of the cons, we know that there's kind of a firearm intent coding skewed toward unintentional at the moment. We also recognize that administrative coding is for reimbursement, not necessarily for public health, and that some of the data governance related to hospitalization, discharge data can be complicated, but we still utilize it. Another big data set that we utilize is emergency department visit data through a system called NC Detect. The data steward is the Division of Public Health, the EPI section. It was started under communicable disease as a post 9/11 a surveillance system. It was quickly recognized that about 20% of all injury and all emergency department visits across the state are injury or violence related. This system is housed at the UNC Emergency Medicine Department with the Carolina Center for Health Informatics. NC Detect has a specific state statute with specific state governance. The Division of Public Health and local health departments and the directors have access to line level data. Data requests for research can be challenging just because of limited capacity and some of the security and HIPAA issues. But again, we've been using a lot of this data, and we also have a piece of it that's used for something called syndromic surveillance, which is using the chief complaints and other keywords. It's kind of a very early use of AI kind of in our field, where we're looking at some of the keywords that people populate for any given case, and then we develop case definitions based on that. And again, used for many, many purposes. For injury and violence, one of our extensive uses was around overdose purposes. So we've been using it for a long time. The great thing about NC Detect is it's near real-time data. But again, it is administrative coding, and it might be skewed toward more reimbursement purposes. There can be some background noise, particularly early on in the case when, again, keywords are used and the presentation might look very different from a final diagnosis. Now what I wanted to do is, while we have those three kind of core systems, we enhance some of those, and we really have a more active surveillance around a handful of things. So here's a list of some of the other work that we're doing, again, mostly around overdose, but in 2 cases, homicide, suicide, and firearm violence. So that's VDRS, the Violent Death Reporting System, and NC FASTER, which is the emergency department firearm-related injuries. So VDRS is a cooperative agreement and effort between Vital Records, the medical examiner, the Office of the Chief Medical Examiner, and law enforcement as part of a national CDC program. Our state has been in operation since 2004, and we have nearly 35,000 incidents that have been recorded in this system. The longer lag time is due to open law enforcement case investigations. So there is a significant lag, but the data is incredibly comprehensive, including precipitating circumstances around those deaths. Again, something that the death certificate alone wouldn't enable us to do. Data is available for public health purposes, and it's just an extension of the death certificate and medical examiner work that happens in our state. NC FASTER, again, an enhanced surveillance system. It was a cooperative agreement between our division and NC Detect. It was funded by CDC for 3 years. Unfortunately, funding ended in the fall of last year. But the effort of that was to really have more timely emergency department, non-fatal firearm injury data, and to develop dissemination plans and products that would allow us to share with partners, which we're actually continuing to do on a limited extent. And Kenla has been really helpful and will be helpful with some of that work kind of moving forward. She also helped create some of these slides and updated some of these slides. So I know she's only been in the place for a couple of weeks, but we were already putting her to good use. And I just wanted to also mention a handful of other health data systems or records that we have found helpful. So our state has 8 level 1 trauma centers. Those are the pretty high level acute care centers across our state, the places like UNC, Wake Med, Duke, Atrium, Baptist, Mission, and ECU, and then New Hanover. I think I listed all 8. So again, those are the centers that have special systems for some of the data they collect. We sometimes use emergency medical services, EMS encounter data. Unfortunately, that system has been down for about a year with a transition in the data system that they're in the vendor that they use. So we had been using it a little bit more in the past, and hopefully they'll come back online in the very near future. We feel that there's a lot of EMS data that's incredibly helpful for firearm and violence related issues, and actually some of the coding issues that I was talking about before. There's been some comparisons between EMS and ED data and the coding, and a review of that. And the EMS is a relatively good reporter of those intent codes. I mentioned the OCME, the Office of the Chief Medical Examiner. Dr. Aurelius has done a really great job working with us around violent death and overdose, and we're really have enjoyed that partnership and continue to work with them closely. We get forensic information and toxicology information from the medical examiner. Again, things that would not be necessarily available through a death certificate alone. I put law enforcement as another health data. Those law enforcement incident reports do actually sometimes contain relevant health information and definitely information around circumstances that are helpful. And then two other systems, the BRFSS, which is the Behavioral Risk Factor Surveillance System, and the YRBS, the Youth Risk Behavior Survey. Those are two statewide surveys, one to adults, the BRFSS, and one to youth, mostly middle school and high school age kids that have self-reported things around firearm storage, access to firearm, access and threat of violence and things of that nature, intent around suicide, ideology, things of that nature. So again, we have all these great systems, and Bill Foege, a longtime CDC director and kind of a public health guru, says the reason we collect it all is to make sure that we actually, try to implement and improve the health. And so if we're just collecting and not allowing resources for action, then we've done ourselves kind of a disservice. So I'd like to talk a little bit about how we've tried to disseminate the data and what we kind of term as data to action. So just off the top, our branch maintains 3 data dashboards that have a significant number of users out there. So on the upper left is part of our violent death reporting system. We have an excessive alcohol use dashboard, and we also maintain the opioid and substance use data dashboard in the state. And again, each one of those has tutorials. Each one has statewide numbers as well as county numbers. And we would certainly encourage the use for kind of some of the general needs to obtain data around certain actions. We also produce and generate a lot of different fact sheets and different kind of documents, kind of data products. These are available kind of on our website and at the website link there, and we can put that in the chat as well. We have at times been able to partner and work with other folks around some of the work that we've done and publish some of that information into kind of the peer-reviewed journals across the nation. And again, a lot of these things are around intimate partner violence, overdose mortality among formerly incarcerated. And so we have a long history of partnering and sharing some of the work and development of some of the surveillance activities that we're involved in. And of course, last year at this time, many of us were involved in a special publication of the North Carolina Medical Journal that was dedicated to firearm injury and violence. And again, that had little sidebars from the governor, the Secretary Brown, as well as Secretary Kinsley, Dr. Tilson, Billy Lassiter, among others. We've also tried to maintain with the VDRS using constant contact and providing some links out to various partners, and we're happy to add you to that list if that would be useful and helpful for you and your purposes. So here's a QR code that you could take a picture of now or utilize later. You can open up that VDRS dashboard and take a quick look at it at any time you're interested in doing that. And of course, I wanted to mention some of the growing opportunities in our partnership with the Office of Violence Prevention. There's a training series and work that we've been trying to partner on. There have been some funding opportunities that we've worked with together. We mentioned the firearm EPI, and Ciara mentioned some of the prevention staffing that's hopefully going to be on board soon. You're all going to talk, and we're going to talk about some of the strategic planning. And then there's been some partnering around research with key partners like UNC Injury Prevention Research Center, as well as RTI and the North Carolina Public Health Association. Okay, let me stop there. That's kind of the background. I've got about another 10 minutes or so of some data slides. I just want to stop to make sure that there's nothing in the chat or any kind of key questions about what I've presented already. All right, hearing none, I'm going to move on. So I'm going to present, again, a handful of very basic data, and we could spend like an entire 10 minutes on each of these slides, but I'm going to try to highlight the things I think are relevant. And again, they'll be available to you as kind of a reference. So these are violent deaths. We talked about the VDRS system being part of that national system. We were one of the earliest states to participate. Now the entire United States is covered, including Puerto Rico and DC. Again, it's a collaboration between the medical examiner, the State Center for Health Statistics, and local law enforcement agencies across the state. We actually work and partner with more than 200 law enforcement agencies every year. Wherever a violent death occurs in one of their jurisdictions, we work with them to identify that death and to make sure that we have relevant information into our system. I'm going to share, again, kind of a main slide on homicide from VDRS and then assault information, which is nonviolent. So this first slide is from VDRS. So these are homicide deaths, all causes, not just firearm. I have some firearm specific data in a minute. So again, looking at some of the demographics, nearly 4 times as many males die by homicide than females in our state. Unsurprisingly to probably this group, non-Hispanic African Americans have one of the highest rates, but maybe more surprising is the high rate of American Indians and their rate within our state. As many of you know, we have a fairly large American Indian population. I think people say it's the largest east of the Mississippi River. And looking at age groups, you can see how this is really skewed the homicide deaths toward that young age group between 19 and 24. And again, these are rates per 100,000. So we're able to make comparisons directly between these various groups. This next slide, switching to emergency department visits, similar in some ways, although it kind of evens out. So again, these are these are emergency department visits that are coded as being assaults. So this includes a handful of small deaths, but also things that are non-fatal. You can see that both male and females essentially have equal rates. Again, you can see a higher proportion of Black, non-Hispanic, and a lower proportion of American Indian, although some would suggest that part of that might be a misclassification of race ethnicity as part of that, and a growing number of both white, non-Hispanic, and Hispanic populations. And you see a slight shift, slightly older, 25 to 44, is the age group most impacted by assaults across our state. Now I'm going to switch to firearm-specific injuries, and the reason for that is among those violent deaths, over 60% of those violent deaths are firearm-related. So when we look at firearm deaths, again, you see a very specific, similar pattern. Again, more males than females. You see similar rates in terms of African American and American Indian, and the 19 to 24-year-old group is high. And this is 5 years worth of data from 2018 to 2022. Switching to emergency department visits, again, with firearm related events, tends to be more males, again, in that category relative to females. And again, Black, non-Hispanic, and American Indian. But much younger, again, a younger population, 19 to 24, also significantly high as 25 to 44-year-olds. So looking at the firearm circumstances, so again, 42% of the 335 deaths, female deaths reported, are related to intimate partner violence. So if you're a female and you die by homicide in the state of North Carolina, 42% of the time it's intimate partner related. When you then look at some of the other categories around the circumstance that precipitated the event, there was an argument or a crime or a drug interaction, you can see how those compare between males and females across our state. Again, to share NC FASTER, which is the non-fatal firearm injuries in emergency department settings in our state. Again, funded from CDC. We were one of 10 states. It ended in August of 23 with the goal of increasing the timeliness of some of this reporting and availability of this reporting. To that end, Ciara and others who were involved in that project helped us create a handful of quarterly reports that we still are producing and we still put on our website and are housed at the NC Detect website that's listed in the bottom corner. And we also push that out, and if you want to be added to some of those push out surveillance efforts, please share your email address, and we'll be happy to include you and add you to those lists. And then one of the other data sources that's been incredibly important for our state is the BRFSS. This, as I mentioned, is the Adult Behavioral Risk Factor Surveillance. This is a survey of about 5,000 non-institutionalized adults across the state, a representative sample from the state. It's asked every year. Well, the survey, the surveillance happens every year, but certain questions are asked every few years, and one of those questions has been around the storage of firearms. And of course, we've utilized this to really initiate some of the NC FASTER work and other work related to unsafe storage of firearms across our state. And I'll just end with, again, probably the younger folks don't know, Tip O'Neill was a legislator or congressional member years and years ago. And the importance of some of the surveillance is that most of this stuff happens locally, and we want to make sure that we're utilizing it both at the state level and at the local level as well. So again, for future reference, I do have some other slides, but for the time being, I'm going to stop sharing here in a second and just open it up for any questions. All right, Sierra, I'm not seeing any questions in the chat either. But again, we're happy to share those slides with the group. We're happy to, help with future presentations. Now that we have Kenla kind of on board, we have a goal of creating kind of what's called a core slide deck. We found this incredibly useful during our overdose efforts, where we basically posted a set of slides, technical notes, and speaking notes, and then people utilized it for presentations locally and across the state. So we're hoping to kind of expand around those features. With that, Sierra, if there's no questions, happy to turn things back over to you.
Yeah, thank you, Scott. Actually, one question just came in the chat from Letitia. She's asking, she said, I may have missed this, but are there any data tracking related to stabbings or beatings?
Yeah, so in the emergency department, there's a fairly comprehensive coding system that uses the International Classification of Diseases, the ICD-10-CM. And as part of that, there are very specific codes around firearms, stabbing, blunt instrument, things of that nature. On the death certificate, it's also, those are investigated deaths in our state and unnatural death. And so Dr. Aurelius and her team and the medical examiners across the state will investigate any case that they feel has a homicide intent, and they can get the information from the ICD-10 and report that out in a very specific way.
Thanks,
So I
Scott.
see Will Baxter's asking for a copy of this data specific to stabbings and beatings. I don't know the specific codes off the top of my head, but we can certainly work toward that and share that information if stabbing and beating is a category of interest. Certainly under violent deaths, there's a blunt force area. There's also a stabbing kind of piece. So for the violent deaths, we have that already coded. For the emergency department settings, we just have to make sure we get the right case definition. And of course, we want it to be a standard case definition. So we would have to investigate that a little bit, but happy to do that.
Thanks, Scott. I think he was asking about what you shared in your presentation. So
Yeah, we'll
be sharing that out. Yeah, we'll be sharing those
Yep.
slides out.
Yeah, the slides, if you're talking specifically about the underlying data to that, there are a process that people can go through to get the line level data for the violent death reporting system. As I mentioned, the deaths in our state are public domain, and we're happy to share that. We've shared it with many academic partners in the past who have published things on that and recorded and done various studies. For the non-fatal, getting line level data is much more challenging. It has a lot more data governance to it, given that people are still living individuals and that there's HIPAA and other requirements that people would need to satisfy. And that office, they don't have a ton of capacity either. So basically we're doing the public health surveillance with the emergency department data. That data hasn't been, it can be shared, but it takes a while to make the sharing happen. Carolyn, I see your hand up.
I know with a lot of the public safety data that Michelle's going to be talking about, one of the big barriers is quality control, data and then also the timeliness of it. It's a lot of the crime data is pretty slow coming in. Do you have the same barriers with a lot of this health data, or is it been a little bit more better administered or codified?
Well, it's mixed. So for death investigations, sometimes the medical examiner and others, if there's toxicologies or if it's really a complicated case, that can take many months to finalize, where the pathologist signs off on the final death certificate. So the deaths that are being investigated, some of them can take a while. I will say, gunshot wound or gunshot deaths tend to be a little quicker investigation. In general. So some of that data is available a little earlier on. Again, if there's toxicology or other information, that still might be a little bit longer. So for the deaths, it goes through our investigation, our medical examiner system, and those medical examiners workload is high, and the overdose pieces have really increased it. So again, it's a function of workload and time. Usually, those data are finalized in about a year. So, if you look at a January 1st death of some year, a year from that point, that data is usually more or less finalized. If we're looking at emergency department data, that's near real time. We get that. We get 3 feeds a day from 131 health facilities across the state. But again, you get a little bit background noise. Again, people present with various things, and again, a firearm might be a little bit more specific. But when I think sometimes of emergency department setting, I think of overdoses and people presenting, and or people presenting for other things and saying, I'm experiencing this, and then when you then follow that case over time, usually within the next few, for that person, hopefully it gets resolved pretty quickly because they're there to get care. But the coding that follows that usually takes a few weeks. And but we usually have relatively good emergency department coding in 3 to 4 weeks after an event. So if someone is injured by a firearm today, about a month from now, I feel pretty confident reporting it, and that isn't going to shift or change. Sometimes there's some other things that shift or change around payment issues and such, but that's not really the reason why they were in the emergency department. So that emergency department data we have investigated. In terms of the data quality, we feel pretty confident in, again, things that are specific around firearm in particular. When it gets to assault, there can be some gray areas, but that's that just then boils down to how that case ends up getting coded and what the intent behind it was.
All right, thank you so much, Scott. That was a great presentation, and as we said, we will be sharing those slides out with you all. And if you have other questions that come up related to Scott's presentation, feel free to put those in the chat, and he can continue to respond to you all. But we're going to move forward for the sake of time to Michelle's presentation. So, Michelle, I'm going to pass it to you.
Okay, thanks. I just got an odd message that my battery is running low. Um, are you still there? Okay.
Yes,
All right. Sorry about that.
no worries.
Um, oops. All right. Nothing like preparing for things and then another thing happens, right?
Yeah, that's always how it goes.
Okay. Are you able to see my screen or no?
No, not yet.
Try again.
There we go. We see the slides, but in just regular view.
Yeah, I'm trying to get it. My docking station died and then came back alive, so
There we go. Looks
okay, good. Hi, I'm Michelle Beck, Director of the Criminal Justice Analysis Center here at the Governor's Crime Commission. And my presentation is going to be a bit different than Scott's. We don't do much in terms of data collection. We are responsible for collecting and reporting data to the Bureau of Justice Assistance for death in custody cases in North Carolina, but that's about the only collection that we do. We are a user of data that is collected by other people. So I love a good word cloud. And so this kind of represents what we do. But specifically, we were reestablished in 2018 to create and maintain a warehouse of data for criminal justice in North Carolina. And we have quite a few publications that we produce on a regular basis. We support any needs of the Governor's Crime Commission for data. And then the Death in Custody Reporting Act is the only data collection that we carry out, as I mentioned. So these are some examples of our publications. Some of them are brand new, like the first one there, the North Carolina Crimes Against Persons. We received the National Incident-Based Reporting System data from the SBI, State Bureau of Investigation. And we have created the Crimes Against Person report and Crimes Against Property report should be finalized and posted this week. In addition to those, we have what we call justice analysis reviews. That's the publication example that's a little further to the right that it has lots of words on it. Those are typically 4 to 8 pages, and it's something that it requires more explanation than our one pagers, which we call portal snapshots. Those are 1 page, lots of graphics. I think kind of cool graphics, especially the one on traffic stop data with the car. So that's some examples of the publications that we do. And then the main work that we've been doing of late is the Justice Data Portal. So I'm opening it and hopefully it won't take long. So if you have not seen our Justice Data Portal before, it is justicedataportal.nc.gov, and it starts with just a basic slide that's an opening. I'm going to turn my camera off just because that's okay. Well, now I lost it. Try again. Okay. So the first page, we call it our landing page, has
Michelle, if you're showing the portal, we're still seeing the slide that just says the Justice Data Portal SaaS Visual Analytics.
okay. Let me change the display setting. You'll let me know. Nope. And stop sharing for a second and then try again. I apologize.
No worries.
And I'll just need to share the other screen. Well, doesn't seem to be there. Okay, well, let me, I'm gonna try to talk through the slides a little bit then. So what I was showing is the first page of our data portal. It has a little description there of the type of data that we have, and then we have what we call quick facts. We currently have two data sources. One is the National Incident-Based Reporting System that I mentioned, and then the other is traffic stop data. Nope, it's not out. I apologize. Well, not sure what happened. I'm gonna try one more time. If you'll be just a little bit patient with me, I apologize for this.
No worries. And if it doesn't work this time, I'm happy to screen share if you want to talk me through where you want me to click through, if that's helpful.
Okay, yeah, I think it may have had something to do with the battery situation I had just a minute ago.
Mhm.
If you could pull up NC, I mean not NC, sorry, Justice Data Portal,
Yeah.
.nc.gov.
Are y'all seeing my
Yeah.
screen? Okay.
Yes, thank you.
Yep.
And then if you'll click down, scroll down a little bit and click on where you see county crime profile. So these are different pages that we have within the crime statistics information. So this shows you a few things I want to point out just before we go any further. One of the really important pieces of this information is the quality of the data that you're looking at. So that's something that Caroline mentioned. So for each county that we have, this is Alamance County because it is the first in the alphabetical order. You'll see at the top right, it says percentage of population covered. For the state, it's 97%, which means that 97% of the law enforcement agencies, oh, no, I take that back. 97% of population covered by reporting agencies. That's the rate for the entire state. For Alamance County, it's 100%. So that means that all of the law enforcement agencies in Alamance are reporting to NIBRS. So what you can see here is a breakdown on the left-hand side with the pie inside the pie. The outer ring is the county representation of the three different offense groups, and the inner ring is that of the state. So 59% of the state's reported crime were property crime, whereas 55% of the reported crime in Alamance was property crime. And then you see the top 10 crimes for the county, simple assault being the top with 15%, and then drug, narcotic violations. And Ciara, if you would go up to where the county is and select Catawba County. Thanks.
Mhm.
So here you see one thing, the percentage of population covered for the county changed a little bit. So 96%, which is still very a high percentage. We have one county that's as low as 36% reporting. So this Catawba County data would definitely be reliable in terms of getting information for the county. Once again, the offense group for Catawba County, the person crimes are quite a bit lower percentage than the statewide. So 16% of crimes reported in Catawba County were a crime against a person compared to 21% for the state as a whole. And then if you look at the top 10 crimes, also you can see that there was a change there. So whereas Alamance, assault was 15%, here larceny is 13%, and then drug and narcotics violations are 13%. And so you can see there are some differences. If you would, Ciara, click back on the left hand near the bottom where it says Justice Data Portal Home. I just want to show you one other difference that you can find. If you'll click on victim demographics, and we'll look at Alamance and Catawba one more time just for consistency's sake. If you'll click on Alamance, so this gives you the statewide demographic breakdown. And then Alamance, you can see the proportion of the racial breakdown, 57% female victims. And in the age group, the largest, most represented category there is 26 to 35%, 36 to 35-year-olds. And that's 22% of the victims reported in Alamance County, which is 8,000, you can see. If you would change that to Catawba County real quick. And then I apologize, change the offense group to person. So this, for victims, you either have, you're the victim of a crime against a person or a crime against property. So person. So for Catawba County, the age group that is the largest for the victims of person crimes is 24%. So if you would click back on Alamance and then you already have person selected, you can see here still the largest group for person crimes for Alamance County is the 26 to 35-year-olds. This is something that is an important feature. Sometimes we've had questions about some of our subrecipients here at the Governor's Crime Commission or people that are applying for grants to, if they have specific target populations that they're serving, this can be helpful for getting that type of information at the county level. So thanks, Ciara, for driving. I apologize.
Yeah, no problem.
For that. But so that's really basically what I wanted to show you. We also have traffic stop data that is on there. We hope to have additional data sources. We're working on that currently to add. The traffic data is a little different presentation. It has statewide and then county, and you can look at some racial discrepancies when we look at the different types of stops and those types of things in the traffic stops. Okay, thank you, Ciara.
No problem.
Are there any questions? One thing I will mention that Caroline brought up is we do have a bit of a lag time because of the data collection. So 2022 is the latest data that is presented in the NIBRS, and we will be releasing the 2023 in a couple of months. That's because of the difference in the timing for different law enforcement agencies to report. However, since we started this in 2021, we've noticed that they're reporting a little quicker. So next year, we're hoping to, rather than reporting the year before in October, we plan to report the year before in June. So a little quicker, but not exactly real-time data. Thank you.
Thanks, Michelle. I want to do one more call for questions. Any questions for Michelle? We'll also be sharing out the link in a follow-up email. We'll share the slides from Scott's presentation and then the link to this portal from Michelle's presentation. So y'all will have access to that. Beth.
Sarah, I had a quick question. Can you hear me?
Yes,
Yes.
yeah.
Okay, sorry, there was like silence. So I was I'm going in and out. I've been getting weird phone calls, and then I had some tech issues. But my question is, are there ways, I think these data reports are great, and the summaries are really, really helpful, for folks who might want to run some of their own analyses on some of this criminal justice data. Are they accessible through the Governor's Crime Commission, or do you need to go through like the NC AOC, or how can we get our hands on those data? Because I don't think they're available through the data portal, right?
No, we don't have a download option. And it would be through the State Bureau of Investigation. And we were the first to really get the release of this data. So I know they are trying to come up with some other dashboard type of presentations, but I don't know about releasing the raw data.
Okay, thank you.
Caroline, I see your hand.
Oh, for some reason, you're muted. That's the reason. We can't hear you.
I'm going to ask the questions. It's going to make your head and Scott's head explode. It looks like you're both, or in both your presentations, it looks like SAS, the visual analytics was used. Is there some way to combine some of these data sets?
So SAS Visual Analytics was used and is used by us, but not by, I don't think. Do y'all use SAS Visual Analytics?
No.
But the answer is yes, because we do have the capability of uploading data into our data warehouse. So one of the that's going to be one of the efforts of our joint Kinla over there. But we do hope to add some of the health data to the data portal, the Justice Data Portal, to have some different measures and be able to do some combination with public health and criminal justice data.
Yeah, most of the data visualization from our end on the dashboard specifically is something called Tableau. And we've been using that for many years now, but there's also some effort, although it's a little unclear, that the state and our department might be switching to something called Power BI. So I guess we'll have to figure that one out. But yeah, we have access to the raw data, and then our team just kind of repackages it and reworks it into both fact sheets and dashboards and reports. And we don't have another system at the moment kind of in place that does that.
Any final questions? All right. Well, hearing none, we're gonna wrap up this portion of the meeting and move forward. But thank you again, Scott and Michelle. Really appreciate you all joining us and sharing that information. And like I said, we'll send a follow-up email sharing all of these links and resources that they've shared today. So now we're going to move into another fun portion of this meeting, which is to talk about our strategic plan, which, as you all know, has been many, many months in the works. And we're really appreciative of the work that you all have put in to help inform what has gone into this draft that we've put together. And so last week, you should have received that draft to take a look through and begin reviewing. And so today, we want to use the time in this meeting to gather feedback from you all in real time. So we're going to split up into breakout groups. And then leading those breakout groups, I am thankful to have support from Caroline, Dr. Tilson, and Zeev. They're going to help with facilitating those conversations in your group, asking you all some questions to collect feedback that we're going to use to inform edits to make to the strategic plan. And we're looking to finalize those edits over the next couple of weeks and then move forward to send it off to comms for copy edits and then for production. So we are really close to having our final strategic plan, and we hope to be able to release it at some point next month. I feel more confident saying that now. So with that being said, Elaine is going to help us with getting into those breakout groups. We've kind of pre-assigned folks, so she knows where everybody is going to go. So she'll open the rooms and it should automatically move you into the room. And I will be in the group that's going to be with our partners. And so just FYI to you all, I will be about a minute or so late because I'm going to hang back to just make sure everybody ends up where they need to. So Elaine, whenever you're ready, you can.
And you'll bring us back automatically, right? We come.
Oh, yes. Yeah. We'll close the breakout rooms and bring folks back. And we're a little off on time, so TBD on the time, but we'll come back to do a report out before we wrap things up today. So we'll see each other again.
So wait, Ciara, when are you going to bring us back? Just so that we can.
We'll send a message in the chat. Right now, we were originally planning maybe around like 10 or so, but yeah, we'll play it by ear because the timing is a little off, so I need to think about it. I can't do math on the spot. So we'll send a message and let you all know, but we'll come back in enough time to do at least a short report out. But we'll try to make sure you all have the majority of your time in the group to have discussions. Okay, any other questions before we go into the breakout groups?
Hey, Ciara, this is Sue Ann. I'm getting off of my phone and getting onto the computer. And so I'm going to be getting out and getting back on. I guess I just wanted somebody to know.
Yeah, no, that's helpful. Thanks for letting us know. And we'll make sure you end up in the right group.
Thanks.
Yeah. All right. Well, hearing no other questions, we're going to open up the breakout rooms now. Okay. For those in the room, so Will, Glorina, Michelle, Crystal, y'all should have seen a message to go in a breakout room. Oh, looks like Will's gone. Okay. Michelle, okay, Michelle's gone. All right, Glorina. Are you seeing a message? Okay. Elaine, maybe Glorina stepped away. So if she does come back and she's wondering, you can move her into group D.
She's assigned to group D.
Okay, cool.
Okay.
And Charlotte, you can feel free to join any group that you want, or you can hang out in here. Yeah.
I don't know how to join a group, but I'm okay. I'll hang out. I've got a bunch of stuff that I'm working on, and I will be here when y'all pop back.
Okay. All right. Sounds good. So I'm going to head into my group.
Thank you.
there we go. Hey everyone, I think this is everyone back. Hopefully your breakout room discussions went well. Yeah, I know mine went really well. Excited to kind of share about that conversation. So we're just gonna do a quick report out to kind of share some of the like high level conversation that came up in the different breakout groups. So I'm just gonna start in order of the groups. So gonna start with Group A, which is you, Dr. Tilson.
Great. Well, thank you. We got stopped right in the middle of what was a good juicy conversation, and Becky and Will and Tracy, you guys were talking specifically of what I was going to bring up, the language, the common language one. So you're right on the mark. So overall, just a readout from our group, and I will welcome anybody in the group to tell me what I forgot. That overall, people liked the clarity and the structure and the accessibility of the plan. We talked a lot about understanding the data pieces and understanding the kind of 3 levels of data, making the publicly available data more accessible to communities, just like the first hour of the conversation, then helping local communities be able to share their data more easily, and then working with our researchers to help our programs collect data that they need to evaluate. So those 3 levels of data. Becky did bring up that there was a conversation in the past about potentially creating kind of a whole new data platform, but recognizing that's probably a bit of a lift, and so moving away from that for those of you who remember that conversation. Then we also talked about what are the ways of really connecting in our researchers with our communities and thinking about it's an and for some of our programs that are tight and close with an academic partner they can run, but also that we want to have some help to connect our researchers to communities. So we clarified that. And we spent a lot of time on goal 2 and thinking about the standards of training, and where we came to, which what this will be written or in the written notes, is thinking about describing this as core competencies, because the word training seemed to trigger, oh, it's this model, that model. Is it Cure Violence? Is it CHASM? Is it? And so the term training felt a little hard, and you're going to have one statewide mandatory training. And so we were really talking about what we're really trying to achieve is making sure everybody has some really key core competencies, especially before they go into the field. So we spent a lot of time on that. And then we were just getting to the question, Ciara, that you want us to pose is the term community violence prevention, is that the right term? Does that really get at that we want to be doing primary upstream prevention as well as violence interruptions? And we were just getting into that and the need.
Oh, no, I'm sorry that we interrupted.
No, that's okay. That's okay. So we didn't quite get to that that piece, but really trying to, the importance of having a common language about describing what we're doing on the ground is really, really important piece. I think that's it. People in my group, please tell me what I missed.
You got it all.
All right. I had the A team. It was, well, I shouldn't insult the other group. my group was great.
Well, good. That sounds like you all had a great discussion, and all of that is really helpful for us to think through and make some tweaks to the wording in the plan. So yeah, appreciate that feedback. So Z, I'm going to pass it to you for Group B.
Well, Dr. Tilson, I actually had the A team, but it's all right. No, just kidding. We had a great meeting. A lot of positive feedback on the format and the layout of the document. We talked a lot about the connection of state to local partnerships and just the importance of local partnerships. And I think sort of how a lot of the work is done on the local level, but also how different communities might need different things. And so thinking about structuring the plan and the offices sort of around that. Our group also liked the focus on the prevention workforce and thought that made a lot of sense. we had a good conversation about cross-sector partnerships and especially about success with non-traditional partners. So Sue-Ann had a lot of great stuff to share with what she's been doing with non-traditional partners in her area around safe storage, which really got me thinking about some good things that we could do in other parts of the state. Some of the other feedback that the group had was around, again, working with local communities, sort of how we were planning more specifically to do that. And then we also talked about, maybe having potentially some metrics that could be tracked, such as like the number of organizations that are involved in this work, other data. And we talked a little bit about the problem with like the time lag with data and maybe partnerships that we could build with local organizations and hospitals and trauma registries to get more recent data. So yeah, that's sort of our conversation in a nutshell, but please add anything that I missed.
All right, sounds like you got it all, Zeev. So thank you, and thanks to your group. Also very helpful feedback. So appreciate that, and glad that folks are already kind of thinking towards like implementation and what some of these things will look like. So Caroline, gonna pass it to you for Group C. That was not intentional. C for Caroline.
C for Caroline, but
Yeah.
which was clearly the best group. We had a great conversation, and I thought we got great feedback. So thank you very much to everybody for the time and energy on our discussion, which was very valuable. It was pointed out, and I think it was a good point, that maybe because for public-facing document, it's kind of long, that we might want to get to our goals and objectives sooner in the document. And one thing we discussed, and maybe was our intent, was in the executive summary to maybe not have them completely fleshed out, but to really identify what the goals and objectives are, and then kind of go through their chronology and the background and the state, the landscape, and which I thought was good feedback. Goal number 2, we spent a lot of time on that, and I think Letitia made a really great point about what these what it means, and that we talked about creating pathways really for the front line that are working. This is not more leadership academies, but also these folks to be part of that training and that professionalization, or whatever we kind of chew on, to include wellness. That this is incredibly hard work for folks that are, that it can be, the work itself can be traumatizing. And so that we have a kind of a wellness component to that, which I thought was really valuable, because we want these folks that are doing this to continue to be healthy, to work in this space and move up in this space. And Becca talked about we might want to really include trauma-informed care, kind of a trauma-informed care lens or foundation when it comes to discussing the that goal 2. And then we did go back and forth a lot, and this is when we came back on the discussion around, it sounds like Dr. Tilson had the same thing, intervention, prevention, and we didn't quite finish fleshing it out. Some folks felt there was a need to name intervention, that it was different. It was related, but different, and that they're very separate roles within that workforce that, frankly, might be the highest risk roles. And if we just say prevention, are we leaving those folks out? So that was a point that was made. We didn't quite finish fleshing it out. I know everybody would be willing to, continue a further discussion along that, whether to include intervention as part of that prevention continuum. And then one last thing that I thought was good was as far as what might be missing, is a timeline for implementation, just to give us to make real kind of what some of these goals are, And I think not to just make it abstract, we want to do these things, but really this is our goal timeline for implementation. And thanks to, again, Team C, coolest team.
Oh, I like that. Super cool. Well, thank you. Thanks for sharing that, Caroline, and to Team C. That is really helpful feedback. So yeah, we've got a lot to process and kind of see what we can do to make some tweaks to yeah, incorporate a lot of that and move the plan forward. So I will also just quickly share about my group, Group D, this group was actually just our partners. So we had representation from Governor's Crime Commission, from IVPB, from JJ, and AOC. I believe are all the groups that were represented. And so we had a really good discussion overall, lots of great feedback about the plan, and appreciation for the clarity that was provided in it about OVP, our functions, and kind of specifically spelling a lot of that info out. Also, like the goals, and there was a lot of appreciation for the data goal, but also some of that conversation about concern about, or already kind of brainstorming, like, but how do we make this happen? So we talked a little bit about that, and our group seemed to feel like there was a good balance between setting like goals, like where we want to go, but being practical about what is possible for our state, and just the capacity and the parameters that we're working with. We also started talking a little bit about dissemination and what that might look like for the plan, and how to leverage some opportunities. So one thing that got brought up is about using our upcoming conference as a opportunity for like a hard launch of the plan after it's circulating and disseminating. So that was helpful feedback. Also, a proposed suggestion came up about including something specific to safe storage and specifically to NC Safe in one of our objectives, particularly under goal 3. And so I heard that safe storage kind of came up in another group. So that's interesting to hear. So definitely something for us to think about, and what we might want to include related to safe storage and how specific we want to get. So that's something we'll talk through as a group. And then also just a feedback that the sooner this plan gets released, the better. So we're definitely going to be working on that. So yeah, so that's for our group. And again, just really appreciative of y'all taking the time to be here today to provide feedback, and all of the feedback and support you've provided along this process. So we're really close to the finish line. So as I said earlier, we're gonna work to kind of synthesize this feedback that we've gotten, make some tweaks to the plan, and then are hoping that we will be able to wrap up content edits by the end of the month and pass it on to our comms team to copy edit, and then design it and make it look great so that we can release it. And I will say at some point in September. I still feel good about that after hearing everybody's feedback. That still feels doable. So just look out for updates for us about that. And of course, once the plan is released, you all will know that, you'll get it, and we'll most likely be asking for your support to also disseminate it across your networks. So, all right. We're just towards the end of the meeting, got 5 minutes left. I do want to open up time for if you all have any updates that you'd like to share with the group about your organizations, events you have coming up, major accomplishments you'd like to share. So anything like that, just want to open it up and give you all space to share anything you'd like with the group. And feel free to just unmute. Okay.
Yeah, I just want to say, and I feel like I'm probably speaking on behalf of everybody, you know, we've had these meetings, but all the behind the scenes work is where so much of it has taken place, and y'all have done an amazing job.
Thank you.
It's been a
Really
really
appreciate
heavy
that.
lift.
Yeah, I appreciate that. It has been, but it's been good. It's been easier because we've had great support from you all, so really appreciative of that. Okay, trying to lean into the silence and give folks a chance in case somebody was working on unmuting. Okay, well, hearing nothing else, I'll move forward, but if, as a reminder, if you all do have things that you'd like to share out with this group, events, reports, things like that, you can always email them to us and we'll disseminate it through our advisory board listserv. So these meetings aren't the only chance to kind of communicate and share with the group. And also just going to do one more plug for our WebEx group that you all also are a part of and have access to, where you can share things in that and also communicate with each other. So yeah, just plugging that as another resource. But all right, well,
Maybe Sarah, one other thing is that if people have comments on the strategic plan that we weren't able to get into in the discussion, could they maybe you'll send them to you, or what would be your preference of soliciting other feedback?
you can send them to me or the OVP inbox, and I would just ask that you do that by the end of the week, because we're hoping to move forward with edits in the next 2 weeks so that we can move forward to send it off to production. So if you have any additional feedback, if you could get it to me by Friday, I would appreciate it. All right. Well, that is all that we have for you all today. So yeah, any extra feedback, feel free to send it our way by Friday. We'll keep you updated on the further progress of the plan. We'll also keep you updated once we've got those two program coordinator positions officially hired and have folks to introduce to you all. And then you receive the save the date for the event. And as advisory board members, you all don't necessarily have to RSVP because you'll be getting updates about registration anyways. But when you share it, can you please share it with your networks and then also have them RSVP, because we're going to try to use that list to kind of streamline future communications about the event. But very much looking forward to that event and hope that you all will be able to join us in November here in Raleigh. And we'll keep you posted once there's more information about that and the agenda and such. And maybe reaching out to some of you to ask if you'd like to participate as a speaker or participate in a panel for that event. So look out for that as well. But if there's no other questions, comments, or things to share, then I will let you all go just a minute early. So enjoy this 1 minute back.